Every day, 27 Canadians are diagnosed with a brain tumor. The most common type of primary malignant brain tumor is glioblastoma multiforme. Average survival, even with aggressive treatment, is less than 1 year. One of the main obstacles in the treatment of brain tumors is the effective delivery of therapeutics across the blood-brain barrier. This barrier serves to protect the brain from harmful toxins and chemicals by allowing only certain molecules to leave the blood and enter the brain tissue. So how do we get anti-cancer therapeutics past the blood-brain barrier? One approach is to use gold nanoparticles as carriers. These nanoparticles are able to cross the blood-brain barrier due to their minute size. Once in the brain tissue, tumor-specific antibodies help to specifically target cancer cells. But how do we focus the nanoparticles to the area of the brain that has the tumor? The Peter Gilgan Center for Research and Learning is home to the Arthur and Sonia Labatt Brain Tumor Research Center. Researchers here have found a way to use MRI-guided focused ultrasound to outsmart the blood-brain barrier. This technique is being developed using mouse models of brain tumors. The mouse shown here has a growing brain tumor and can be used to evaluate the delivery of therapeutic-laden gold nanoparticles to tumor tissue. Via the tail vein, the mouse is intravenously administered ultrasound-responsive microbubbles. As the microbubbles reach the brain and the tumor capillary bed, magnetic resonance imaging is used to focus ultrasound waves on the specific area of the brain where the tumor is located. The ultrasound waves trigger transient size enhancement in the microbubbles. The swelling of the microbubbles within the ultrasound field causes microscopic physical disruptions of the capillary lining and results in a localized, temporary breach of the blood-brain barrier. The mouse is then injected with the therapeutic-laden, antibody-coated gold nanoparticles. The nanoparticles travel in the blood, reaching the area of the brain tumor. The holes in the capillary linings, temporarily created by the microbubbles, allow the nanoparticles to escape the blood-brain barrier and enter into the extracellular space of the tumor tissue. This results in a concentration of gold nanoparticles in the region of the tumor. Tumor cells have receptors expressed on their surface. The antibodies on the surface of the nanoparticles allow them to bind to certain receptors that are enriched on the surface of tumor cells. Binding to the cell surface receptor triggers internalization of the nanoparticle. The internalized nanoparticles release their anti-cancer drugs within the tumor cell, triggering the cell to die. This process occurs simultaneously throughout the tumor, resulting in widespread tumor cell death. This not only significantly reduces the size of the brain tumor, but importantly, eliminates aggressive, invasive cells along the tumor border. With success of this tumor targeting strategy in mouse models, it is our hope to apply this technology to the treatment and elimination of various types of human brain tumors.